We're already in Chapter 13. So in Chapter 13, we're really focusing on managing risk and focusing on that quality and safety culture and looking at the value of the care that we deliver. So as we're looking at healthcare in general, it's a hugely expensive process and system within our nation. So it's really important to be very effective in what we do so that we can do our part in helping not only our organization to be effective in delivery of care, but really for society in general, as far as each one of us has a responsibility to provide the most efficient and effective care to those that we serve. So when we're looking at some of the key perspectives, we're looking at microsystem analysis. So we're really looking at what we're doing. So with that being said, the book goes into the 5 Ps, and that's really important to understand and also think about measuring those 5 Ps to assure that the care delivery is safe and a quality product, and that there's great value in the care that's being provided. So when we're looking at those 5 Ps, we're looking at the purpose, we're looking at patients, and the patients may be a population in general. So we're looking at processes, and very often our processes within an organization are very complex, and many times those processes can be refined. And keying into a very popular system is looking at lean and developing those processes and systems so that they're very effective. And so we're looking at patterns, we're looking at providers. So it's important to have systematic measurement in each one of those 5 areas as well. So when you're looking at a particular area of focus, you want to design those questions as you're working on your quality or safety initiatives, and look at those questions involving the care delivery process or a problem within the care delivery process. And one approach is actually the PICO question, and that's really focusing on the population, the intervention at hand, a comparison, comparing what's being done to what could be done, and looking at outcomes and time frames. So those are really key elements to examine as you're looking at improving a process within the healthcare delivery system. So as we're looking at those issues that we're examining, we really want to make sure that we're focusing on the science of improvement. We're looking at evidence-based practice, and we're also looking at those theoretical or conceptual frameworks. So it's important to really take a step back and look at those conceptual or methodology, I can't even talk today, theoretical frameworks that will help frame what you're doing and how you're moving forward. And very often we think about theory as something kind of out there, when in actuality, when we're looking at theory, theory is based on practice, and it's based on studying practice over a long period of time. So it really, understanding theory helps you to understand what happens in practice. So it's not this vague, nebulous thing out there, but in actuality, theory is practice studied over time. So it informs us as we're making changes in how we're delivering care as we move forward. So moving forward a little bit in the book itself, and we're looking at some of those quality improvement tools. So we're looking at doing a systematic process when we're looking at plan, do, study, act. It's a very familiar terms for doing quality improvement, but there are a number of different processes, but they're basically the same. And basically looking at, and if you think about it, they kind of correlate with change practice as well. We're planning on what we need to do, and we're doing that. And part of our plan is looking at evidence-based practice and those theories. So we actually apply those in practice, and then we examine how things are going. And it's a cyclic process. So we want to make sure that we're constantly reassessing what we're doing and kind of resetting a little bit and improving as we go. So that's one of the critical factors, and evaluation is a huge factor when we're looking at quality improvement and making sure that it is indeed effective and it's doing what we want it to do. And when we tie back to some of the change processes that we integrate in practice as well, part of that is developing a means for sustainability of an effective change. So again, all of these concepts really tie very well and kind of mesh together when you're doing your leadership practice, and kind of keep in mind how everything needs to kind of fit together, that you have to have this very complex thought process as you're doing your quality initiatives and improving practice over time.